I think that to an extent doctors are putting themselves in a certain amount of risk by the profession that they've chosen. So contagious diseases and that sort of thing, I think, are sort of a hazard of the job. But again, I think that people have to take a certain amount of responsibility. And somebody who's violent towards a doctor or something like that, I think actually you say, well, they have a right to access healthcare, but not at any cost, and not at any cost to the doctor's safety. So I think there should be instances where doctors could refuse to treat, but there would be, you'd have to be selective about what they were.
Anything that endangers a doctor has to be avoided at all costs, whether that be the threat of physical violence from a patient or possibly being infected by a contagious disease. Absolutely, yeah. Safety is at a premium.
I completely agree that
Absolutely.
actually that's just a yes. I mean, if somebody is being threatened in their surgery, then they should have the right to say, I will not treat you.
Yeah, they have the right to refusal.
And that's threatened in life-threatening either or.
Yeah.
They should be able to say no. It's their choice. If they don't feel comfortable treating a patient, then they don't feel comfortable. They can't change that. So, no.
I don't know. It's a difficult one, that, because if it was a doctor that was in a war zone, then it goes without saying that, of course, his life's going to be in danger. If it was a local GP and there was a known patient that had sort of psychopathic tendencies that may walk into his surgery with a knife, then yeah, I wouldn't object to him refusing to treat him, you know. So I think it very much depends on the circumstances.
Well, during their swine flu crisis that they had in 2009, I had a job that put me in charge of the operating theatres at that time. And we had to take extra precautions to know that if someone comes in who has swine flu, suspected swine flu, you had to know how to treat them. You can't refuse to treat them because they are patients, but you knew the risks and you had to be able to treat them. You can't turn someone away because they've got a contagious illness.